Okay, 1 minute. Okay, you ready, Atta?
Yes, I'm ready. Just
Okay, here we go. Hold on. 10, 9, 8, 7, 6, 5, 4, 3, 2. Good morning from Miami. This is Dr. John Bennett broadcasting for Neurosurgical TV. We have the honor today of having a dual neurosurgery webinar with Japan. And I'll let uh, Atta Bhatti, he's a neurosurgeon. He's based in Switzerland with a special interest in dual neurosurgery, and he'll be moderating these proceedings. Welcome, Atta.
yes, thank you, John. We are glad to have Professor Takahiro Ota, hybrid vascular neurosurgeon and skull-based neurosurgeon from Tokyo Metropolitan Tama Medical Center and director of neurosurgery with a very experienced profile chairing this session. And we have two speakers today. The topic we chose is regarding a very important anterior circulation artery, which is small but very precious for the function of brain, and although not very common, 2 to 5% of aneurysms involve anterior choroidal artery. And this session will start from the talk of Professor Kaisiko Kaduka. Let me introduce Dr. Kaisiko Kaduka, Chief of Neuroendovascular Surgery, Komeda Medical Center, Kamogawa, Chiba, Japan. He's a dual trained neurosurgeon, and part of his training is from University of Zurich Hospital Neuroendovascular, and he has a very broad spectrum of cerebrovascular disease experiences, and his main interests are also in neuroanatomy, and he is working in Pameda Medical Center since 2013. And from 2017 to 18, he was in Zurich as a international fellow in neurointervention. So can I invite Dr. Kaduka to present first?
Yes, thank you, Dr. Bhatti, for your kind introduction. I will share my slide. Can you show my slide? Okay. Okay. Good evening, everyone, and thank you for joining today's webinar. I'm Keisuke Kadoka from Kameda Medical Center, Japan. My talk is on the functional vascular anatomy of the anterior choroidal artery. Here is today's outline: embryology, anatomy, clinical symptoms, and Cone-beam CT. Okay, I'm going to start with the embryology. These are figures from Paget and a little modified. At the stage of 5.5 millimeters embryo, the internal carotid artery has a cranial and caudal division. On the right figure, at the stage of 9 millimeter embryo, you can find the cranial division gives rise to arteries, anterior choroidal artery and primitive olfactory artery. This artery is the precursor of anterior cerebral artery. At this stage, the anterior choroidal artery is one of only two cortical arteries. It is therefore considered a very ancient old vessel. These figures from Rajania's textbook illustrate the development of the anterior choroidal artery. In the precolloidal stage, the anterior choroidal artery gives off both telencephalic and diencephalic branches. And the choroidal branches of the ACA, the seven, and anterior choroidal artery connect at the foramen Monro. This is called choroidal arcade. And the anterior choroidal artery also anastomoses with the posterior choroidal artery from the ICA caudal division. In addition, telencephalic branch of the ACA and anterior choroidal anastomose, this is called telencephalic arcade. The previous slide is choroidal arcade, and next is telencephalic arcade. At the telencephalic stage, blood flow is craniopital from the vertebral artery to the vagal artery. This flow supports the development of the diencephalic, mesencephalic trunk of posterior choroidal arteries. This number 14. The developed mesencephalic trunk and the choroidal branch of the anterior choroidal and anterior cerebral artery form further anastomosis here. From this stage, the telencephalic branch of the posterior choroidal artery begin annexing cortical territories of the ACA and anterior choroidal artery, and the cortical branch of anterior choroidal artery regresses. This is so-called distal annexation. The choroidal branch of the posterior choroidal artery develops into the lateral posterior choroidal artery, and the encephalic branch of choroidal branch becomes the medial posterior choroidal artery. The lower right is the final configuration. This slide shows the homology of the anterior choroidal artery in different vertebrates. The red labeled vessels are considered homologous to the anterior choroidal artery. In fish, the lateral olfactory artery from the rostral division of the ICA is homologous to the anterior choroidal artery. And next, in amphibians, the posterior telencephalic artery, this artery, is homologous to the anterior choroidal artery. And in reptiles, the inferior cerebral artery, the name is a little different. Inferior cerebral artery is homologous to the anterior choroidal artery. And in birds, the so-called posterior cerebral artery. This is not the same thing as usual posterior cerebral artery, because this so-called PCA is origin from the rostral division, cranial division of ICA. This is different from the usual PCA. In summary, all vertebrates have a vessel homologous to the anterior choroidal artery. The next topic is the anatomy of the anterior choroidal artery. Here is the anteroposterior view. The anterior choroidal artery usually arises posterolaterally from ICA. Yes. Now you can see the choroidal plexus in the venous phase. And here is the lateral view. This is aneurysm patient. It causes the anterior choroidal artery causes convex upward, this upward, before sharply bending and entering the lateral ventricle. The top summit of the convex is called anchor point, and this bend is called plexal point. After this plexal point, the anterior choroidal artery gives choroidal branches. Okay. The anterior choroidal artery arises from the internal carotid artery in the carotid cistern, just distal to the posterior communicating artery. It has two major segments, cisternal and plexal segment. As I mentioned before, the highest point